All right, let's get right into it. Today, we're looking at something incredibly powerful in the fight against cervical cancer. It's a clear, expert-backed roadmap for prevention, and we're going to break down exactly how this plan is designed to save lives.
Just think about it for a second. What if we had a clear, step-by-step guide to prevent a major cancer that affects women all over the world? A plan that tells you exactly what to do and when to do it.
Well, that plan isn't just a what if, it actually exists. A whole panel of India's top experts from FOGSI, that's the Federation of Obstetric and Gynecological Societies of India, they got together and created these good clinical practice recommendations. This is the exact roadmap we're going to explore today.
Okay, so here's how we're going to break it all down. First, we'll look at why this plan was even created. Then, we'll dive into the two big pillars, vaccination and screening. After that, we'll see how this whole guide adapts for different communities. And finally, we'll cover what happens if a screening test flags something.
So you might be asking, why were these specific guidelines needed? Well, the answer is simple. India. It's an incredibly diverse country. The approach that works in a high-tech city hospital just isn't going to work in a local outreach camp. So this plan, it was built from the ground up to be flexible, offering the best possible options no matter what resources you have.
So where do we start? The very first line of defense, what experts call primary prevention, is the HPV vaccine. The best way to think about this is like building a protective shield against the virus that causes most cervical cancers, way before it can even think about becoming a threat.
Now, when it comes to this vaccine, timing is absolutely crucial. The guidelines are crystal clear. The sweet spot, the ideal window to get the HPV vaccine, is between the ages of 9 and 14. And why so specific? Because that's when a young person's immune system is basically a superhero, ready to create the strongest defense possible.
And here's the best part about starting in that perfect age window. The schedule is so simple. It only takes 2 doses to get that maximum protection. That makes it so much easier to get it done and be fully protected.
This chart makes it super clear, right? Look at the difference. If you start before age 15, it's a simple 2-dose deal. But if you wait until age 15 or older, that jumps up to a 3-dose schedule. So vaccinating in that younger window isn't just more effective, it's also way more straightforward.
Okay, but what about real-life situations? Things get complicated. People have really important questions about this stuff. What about pregnancy? Or what if someone is HIV positive? These are great questions, and the guidelines tackle them head-on.
And the guidance here is really straightforward and reassuring. During pregnancy, it's not recommended just as a precaution. But, and this is important, if it's given by accident, there's no need to panic. It is perfectly safe to get while breastfeeding. And for individuals who are HIV positive, it's not just recommended, it's strongly recommended, just with a 3-dose schedule to build up the strongest immune response possible.
Okay, so vaccination is that first amazing shield. But it's not the whole story. For adult women, regular screening is that second critical layer of defense. It's all about catching any potential issues as early as humanly possible.
So what are we even talking about when we say screening? Let's be really clear. It is not a test for cancer. It's a proactive health check designed to find pre-cancerous cell changes. Finding those changes early means they can be treated simply and effectively, stopping cancer before it ever gets a chance to develop. It's an incredibly powerful tool to have.
And what's great is that the guidelines recognize there isn't just one magic test that fits every single situation. Yeah, the HPV test is considered the best method, but there are other really effective options too. You've got cytology, which you probably know as the pap smear, co-testing, which combines both, and even a simple visual inspection called VIA. They're all valid tools in the toolbox.
And this right here, this brings us back to what makes these guidelines so brilliant and so practical. They're designed for the real world. They adapt the what and when of screening based on the resources that are actually available in a community.
So what does that actually look like on the ground? Well, in a place with a lot of resources, screening might start around age 25 and happen every 3 to 5 years. But in a place with more limited resources, it might start at 30 and be done every 5 years, with a goal of getting it done at least 1 to 3 times in a woman's life. Both paths are valid, and both paths save lives.
Whoa, okay. At first glance, this flowchart looks pretty intimidating, right? But stick with me. It's actually just a decision tree. It's designed to guide a healthcare provider through a series of simple yes or no questions to find the absolute best screening path for their patient. Let's actually trace one of those paths together.
Let's make this real. Follow me down one of these paths. The flowchart starts with a very practical question. Can your clinic, or can the patient, actually afford an HPV test?
And if the answer to that question is no, the chart doesn't just throw up its hands and stop. It gives you the very next best step. In this case, it guides the provider to use VIA, that simple and effective visual inspection method. You see, there's always a clear path forward.
To make all of this as seamless as possible, the guidelines champion something called a single-visit approach. The goal is just what it sounds like: get everything done in one appointment. So in a see-and-treat clinic, a diagnosis and the treatment can happen on the same day. In big public health programs, a screen-and-treat model means an abnormal screen can lead right to treatment right then and there. This is a game changer for women who might have traveled a long way to get care. Okay, so let's tackle the big question. What actually happens if a screening test does show something unusual? This is where this roadmap is so important, because it lays out a clear, calm, and structured path forward to manage whatever comes next.
The whole process is broken down into these clear, manageable steps. There's no guesswork. A positive screen leads to more evaluation, usually with a procedure called a colposcopy. That's just a fancy word for getting a magnified look at the cervix. If something needs to be done, it's followed by a simple treatment to remove the abnormal cells. And finally, a follow-up plan is put in place for long-term health.
And you see, it all comes back to that core principle, the single-visit approach. It's not just about being efficient. It's about respecting a woman's time and making sure that the entire journey, from screening to treatment, is as clear and simple as it can possibly be.
I wanted to share this quote from the committee chairperson because it just says it all. This isn't just some dry medical document. It's a tool for a shared, common battle, a battle to save lives and work towards eliminating this preventable disease for good.
So, there you have it. We've walked through the entire plan, from the first shield of vaccination to screening and all the way to management. The roadmap is clear. The only question left is the one that really matters. What is your next step?